Alright guys, in this video we are going to do a trauma testing scenario. So once again, I'll have 12 minutes to assess and treat my patient. And Cindy will dispatch me and then time will start after the dispatch.
Alright, you're being dispatched to a skateboard park for a male patient with wrist pain and possible head injury at 4:22.
Alright, so I arrive on scene. I'm going to check my scene, make sure that my scene is safe. Looks like my scene is safe. I've got my BSI on, so as I approach my patient, I just see one patient.
Yes.
Okay. I'm going to, since I am an MFR, I'm going to call for ALS. Make sure I have an ALS unit en route. So, since we're at a skate park, I'm going to approach. Hi, sir. My name's John. I'm with the fire department. What's your name?
My name's Saeed.
Saeed, what happened?
I was just playing and I fell down. I hit my head.
Okay, since you fell, I'm going to come behind you here, and I'm going to hold your head just nice and stable like this, okay?
Okay.
Are you having any neck or back pain?
No.
Okay.
Just
So
my head.
I'm talking to him, so he is alert. He's answering back to me. His airway seems to be open.
Oh.
Looking at his breathing, he seems to be breathing normal depth, normal rate, and regular.
Yes.
Okay. I don't hear any extraneous sounds. Looking at his skin looks pale, pink, warm, and dry.
Yes.
Okay. Do I see any active bleeding?
Above his right eyebrow, is a scrape.
Is it scrape? So minor bleeding from
Abrasion.
that?
Yeah, minor.
Oh, excuse me. Alright, Saeed, what I'm going to do, I'm going to have my invisible partner take over C-spine for me. Okay. So he seems to, he's alert. His ABCs are all normal. Saeed, I'm just going to pinch here. Cap refill.
Normal.
Okay, I'm going to check a pulse real quick. Pulse feels strong and regular and normal rate.
Yes.
Okay. So based on my ABCs, I'm going to classify him as a low priority patient at this time. He's complaining of that wrist pain and then his head. But I'm going to start by checking his neck and back since he did fall. So that's minorly bleeding, so I'm not worried about that. Saeed, I'm going to touch your neck here. Any pain?
No.
Okay, I'm going to go right down your back. Any pain down your neck or back here?
No. At all.
Okay. Neck and back seem good. Okay, I'm just going to check your pulses here. How does this wrist look as I'm at it? That he's complaining of pain on the right side.
Swollen, no deformity.
Okay. Pulses feel equal bilaterally. Said without looking, what finger am I touching?
Index.
Okay. What finger am I touching?
Middle.
Can you wiggle your fingers for me? How about on this hand? Does that hurt to wiggle?
A little bit.
Okay, I'm going to have somebody stabilize this wrist since it seems painful while I check out his feet here. Check pulses. What toe am I touching?
Big one.
How about here?
Big one.
Can you wiggle your toes for me? Any pain as you do that?
No.
Okay. Alright, so I'm just going to check you out here real quick. I know that wrist hurts. I just want to make sure you didn't hurt anywhere else. So, can you look at me? I just want to see your pupils real quick. Cover. Pupils seem equal, round, reactive.
Yes.
Any blood or
No.
other fluids from the ears or nose?
None.
Can you open your mouth for me? Okay. Mouth looks normal. Any pain here in your head?
No.
Okay. Just that small abrasion there. How about your neck? Any pain in your neck?
No.
Trachea appears midline. Jugular veins don't appear to be distended. Feel your clavicles, any pain?
No.
Pain here? Okay. Can you take a deep breath for me? Chest rise and fall is equal bilaterally. I don't feel any crepitus or deformity there.
You do not.
Okay. As I'm going, I'm checking for a DCAP BLS tick on every body system. So that's deformities, contusions, abrasions, penetrations and punctures, burns, lacerations, and swelling. and then tenderness, instability, and crepitus on every body system as I check here. Said, I'm going to listen to your lungs here real quick. Come under your shirt here. Oh, on the other side. Said, when you fell, did you lose consciousness at all?
Not at all.
Okay, good. Were you wearing a helmet?
No.
Okay. Might be something to think about in the future. I'm gonna feel your belly here real quick. Any pain in your belly?
No.
Abdomen soft, non-tender to palpation?
Yes.
Okay. I'll check your hips here. Any pain as I push on them here?
No.
Okay. Just gonna go down your leg here real quick. So upper leg, knee, lower leg, no decap BLS tick.
No. All clear.
Same thing on the other leg, upper leg, knee, lower leg, no decap BLS tick.
No. All clear.
Check this arm since he's not complaining of any pain. Good. Okay. And then the hurt arm.
Ah.
Any crepitus in that wrist when I feel it?
No.
Okay. Alright, Said, so since you're complaining of pain in that wrist, I'm going to do a splint on that real quick, okay?
Okay.
And then how's that abrasion on his head? Is it still bleeding a little bit?
Just a little bit.
Just a little bit? Okay. See, that abrasion on your head is still bleeding a little bit, so I'm gonna put a bandage on that, and then we'll splint your wrist up, okay?
Okay.
Since my partner's still holding that wrist for me. Alright, so I'm just gonna wrap this around your head, stop that little leak that's going here. Said, how old are you?
20?
Alright. Do you take any medications on a daily basis?
No.
Are you allergic to anything?
I don't think so, no.
Okay. No allergies, no meds, no history at all? When's the last time you ate something?
This morning?
Okay. Did you use the bathroom this morning?
Mm-hmm.
Is that all normal?
Yes.
Okay, my partner's holding that. Can I see this arm real quick? So how long ago did you fall and hurt yourself?
20 minutes ago.
20 minutes ago? Okay. And what were you doing that made you fall?
I was just having fun, then I don't know, I just fall down.
Were you doing like a trick or anything, or were you just like moving along the ground and fell?
I was just moving.
Okay. I'm just gonna shape this to your wrist here while we're talking. What number would you give that pain in your wrist, 0 to 10?
I'd say 7.
A 7? Alright, you can relax that arm down. Does it go anywhere else, or does it just hurt there in the wrist?
It's just the wrist.
My partner's gonna help me just rotate this. I know, I'm sorry. I'm gonna get this wrapped so that it doesn't hurt as much though. So I've got a void here that I'm gonna pack. My partner would be holding that up for me. I know, I'm sorry, Said. We'll get this wrapped and it'll feel a lot better. I'm just gonna rest that right there on my knee. Alright, so I'm gonna wrap this around your hand and wrist first. So around your thumb here. Hopefully this will make your wrist feel a lot better once we're done with this. There we go. And my other wrap here. How long have you been skateboarding for?
Since I was a kid.
Okay. Have you ever fallen and hurt yourself like this before?
It's the first time.
First time? Okay. Well, I know I said it before, but it might be a good idea to invest in a helmet.
I'll get a helmet, I think.
I know this time you only scraped your head a little bit, but you only get one brain. Unless you're Frankenstein's monster, I guess. Okay, so there's that. Then I'm going to put that in a sling to help immobilize your elbow. Pull that right up to your chest here.